And Chair is now pleased to recognize Mr. McKinley for 5 minutes.
Thank you, Madam Chairman. And Dr. Walensky, speaking of the misinformation being disseminated that Kathy McMorris-Rogers brought up earlier, my Twitter account has been lit up during this hearing by people posting that President Trump killed 500,000 Americans. So, Dr. Walensky, would you agree with that statement? Is that an accurate statement that Trump killed 500,000 people?
Thank you for that question, Representative. I came into this office in 2020 and on January 20th and came into this administration on.
It's a yes or no, Dr. Walensky. Is it did he or did he not kill 500,000 people?
I think the effect of this pandemic is multifactorial.
Sure. Oh, I can see where this one's going to go. So, Dr. Fauci, if I could turn to you, since she's not going to answer the question. Well, on the campaign trail, we heard time and time again from the then candidate Biden that the president's words have consequences. Then on Monday, the National Review reported that President Biden proclaimed that Americans should wear masks until everyone is vaccinated. Now, I'm not aware of any healthcare professional expecting that 100% of the population will be vaccinated. So, Dr. Fauci, do you agree that Americans should wear masks? Do you agree with the president that Americans should wear masks until 100% are vaccinated?
You know, I'm sorry, Congressman McKinley. I did not hear that statement, and I pretty much follow what the president says. I didn't hear him say that everyone should wear masks until 100% of people are vaccinated.
He said until everyone is vaccinated. He didn't say 100%. He said until everyone.
Well, everyone is 100%.
That's what I thought so too. So I'll tell you what, Doctor, I'll send you a copy of that. It was on several news outlets about that, but it first broke on National Review. Let's go back to try to get a straight answer from Dr. Walensky. Dr. Walensky, regrettably, 288 children have died from COVID, according to the CDC. And that's a tragedy by any measure. But that number actually mirrors the annual deaths due to seasonal flu with children. So at the beginning of the pandemic, we closed schools, and we understand that. We didn't know the effect COVID could have on children and teachers, but now we know. So the data suggests the spread of the virus is minimal in schools. They use safety precautions, even in communities with high disease prevalence, and teachers are being vaccinated. So college students can go on spring break, and bars and restaurants can open up at full capacity, but children can't go back to school, and people cannot attend church services. Dr. Williams, communities and states are looking to the CDC for guidelines. Will the CDC be updating their school reopening guidance this week? Regarding giving the new data available?
Thank you very much for the question. We recognize the challenges of having children home. I want to articulate that, respiratory viruses frequently travel in schools, and I think we were cautious when we had a respiratory virus, and we were worried, like influenza, that this virus might behave in the same way. We published operational guidance to get children back. In fact, it was intended to have schools lean in to get the schools that were closed open, and we very specifically said the schools that are doing well should not close. And so now we have emerging science that looks at the 3 feet versus 6 foot rule.
Okay, thank you. So are you going to be, so if I've got one last question that I don't need to be filibustered on. Dr. Fauci, last summer, while the pandemic was raging, we also had social unrest, unfortunately, happening in the country. Thousands of people, understandably, were gathering to protest racial injustice. The media and some public health heralded these protests. In fact, 1,200 public health professionals signed an open letter arguing that protests against systemic racism must be supported, quote, even at the cost of spreading the virus. Dr. Jennifer Nuzzo of Johns Hopkins stated publicly, quote, public health risks of not protesting exceed the harms of the virus. Dr. Fauci, do you agree with that statement?
My stance has always been that we should abide by the public health measures that we talk about all the time, which is avoiding congregate settings, wearing a mask, washing your hands.
So you would think that they maybe weren't justified?
I'm not going to get it. I'm not going to get into the justification or not of who demonstrates about what. I'm just going to give you the public health measures that we talk about all the time and not get into the background or basis of a demonstration or not.
Thank you. Thank you. I yield back.